Hello and welcome to another Wellness Wednesday. This week I wanted to take some time and talk about the topic of microaggressions and how that affects your overall health. When I use the term microaggressions, I'm specifically talking about indirect, subtle, or unintentional discriminatory acts against members of a marginalized group. Microaggressions are very commonly used when it comes to race, but it does affect individuals based on ethnicity, gender, sexuality, and religion. There are different types or categories, so to say, for how microaggressions happen. One of them being micro insults, whether it's conscious or unconscious. It is criticizing a minority group's cultural style, values, or practices. There is also pigeonholing, which is undermining, confining, or exaggerating a minority group's mental capacity, behavior, or appearance. We also have excluding and rendering invisible. The message that these groups receive in this type of microaggression is that they don't belong or they're not seen. We also have the microaggression of perpetuating dismissive attitudes when it comes to the oppressive experiences felt by these minority groups. For health implications, it is discussed also as death by 1,000 cuts. It isn't the one cut or the one thing that is said. It is the fact that small little things are said repeatedly over and over and over again that cause this detrimental effect to individuals' health. One part of it is that it does create a major inner conflict for individuals who deal with microaggressions on a daily basis. This increases their risk of traumatic stress symptoms as well as their risk for depression. Microaggressions are also linked to chronic infections, thyroid problems, and increased blood pressure. There are a few coping mechanisms for those who do deal with microaggressions on a regular basis. Having connection and some sort of a support group is extremely helpful in these situations. There are types of coping called resistance coping, which is really combating those microaggressions. So resisting things that are deemed normal, just going out of your way to not represent any of those typical norms, defying stereotypes, as well as direct confrontation when you experience some type of microaggression. And then there's also self-protective coping mechanisms, such as self-care, adopting a positive outlook, picking your battles, and then also making sure you're setting boundaries. But the biggest part of microaggressions is that they are done to individuals who are affected by them most. So as individuals educate themselves more on what microaggressions are, you can be aware when you do inflict a microaggression on a member of a minority group, as well as being able to see that happen and able to step in and kind of educate another person so that we have less circumstances or situations in which microaggressions occur. And overall, that helps those individuals who are most affected by microaggressions not have to deal with those detrimental health effects.